Hello, and welcome to today's NAACP Connect Google Hangout. I'm Shavon Arline-Bradley, the Executive Vice President of Strategic Planning and Partnerships for the National NAACP. We are live here at the Department of Health and Human Services with our special guest, the Secretary of Health, Sylvia Burwell. Now, to kick off this series of online conversations, we're going to discuss the Affordable Care Act. And this is really important to the African American community. Statistics are telling us that the African American community is one of the most under and uninsured populations in our country. But we have to change that stat. And so we're here today to talk to our special guest. Secretary Burwell, thank you so much for joining us today.
Thank you. Happy to be here. So glad you could have me.
Awesome. We're going to jump right in. We have a few questions for you and really wanted to start at the beginning. Now, what is the Affordable Care Act? And could you help us understand what is the health insurance marketplace?
So the Affordable Care Act is a piece of legislation that was passed and the President signed that focused on three important things: quality, affordability, and access of health care for the nation. And in terms of quality, improving that quality that is delivered to the American people. And that means things like, last week I announced that harms, which are things like falls in hospitals or infections, things that happen in a hospital, have been reduced by 17%, improving in quality. In terms of affordability, we know that 85% of people that came into the marketplace and got insurance had financial assistance so that it could make their health care affordable. And we also know that in the past 4 years, from 2010 forward, we've seen Medicare spending reduced by $116 billion, and that's savings to the taxpayer. The first savings to the individual, the second taxpayer. And then we also know that last year, 10.3 million adults went off the rolls of the uninsured to the rolls of the insured. That's access. The marketplace is one of the tools that we have to try and reduce those numbers of people in the country who are uninsured. And what the marketplace is a place where you can come in, shop, compare, and get affordable health care coverage. And by that I mean the coverage you receive, financial help from the government to make that care affordable, and encourage everybody to come in and check it out. You can window shop. Just put in all you have to do is put in your income and put in your zip code, and then you can shop by premium, how much you would pay on a monthly basis, or deductible.
Well, you heard it here from our secretary. Now, you started to actually answer this next question, but I want to reiterate it to our listeners. And the question is, how many people during the last enrollment cycle enrolled in the Affordable Care Act or the marketplace, and how many African Americans gained insurance in this process?
So the number, in terms of the number of people that enrolled and were what they call effectuated, that means paid throughout the year, was 6.7 million people. And what we do know is we know that last year, that 10.3 number that I said in terms of the whole nation reduction in uninsured, that 1.7 million of those were African Americans in terms of people who got insurance last year that are African American. So making progress on reducing that number of uninsured, which is especially important because the number is high, 17%.
And that is a very high number, 1.7 million. And that is a number that we're going to stick to because we're excited to hear about this stat. Now, what is your goal? Because we have now a new cycle. What is the goal for enrollment during this cycle?
So our goal this year is to see that throughout the year, and that will be until about October of next year, that we have 9.1 million people that come in, enroll, and stay enrolled for the year. And so that's our goal for this year, and we're in the middle of our open enrollment, which started November 15th and goes until February 15th. And so during that period of time, we hope two things happen. One is that all those people who enrolled last year, they come back in and they re-enroll. They'll be automatically re-enrolled if they don't enroll themselves, do it themselves. But we encourage everyone to come in because premiums change, plans change. You should come in, make sure your information is up to date, number one. Number two, shop and enroll to make sure you have the best plan and the most financial assistance that you're allowed to get.
Over 9 million enrolled and re-enroll and enroll. Excellent. So Now let's talk about this. What are the items or documents that consumers may need to enroll into the health insurance marketplace? There's been some questions about that.
So folks need their social security number or other form of identification if they don't use a social security number, so that we can check and make sure, because we want to keep the site secure and make sure that we check the people. So there's that. Then there's information about your income, and that's for all members of your family. If you're enrolling for yourself, just for yourself, but for your whole family, if there are other members, understanding the income information about how much you earn. The next is if you have any other health insurance, what's that plan? So that can be calculated as well. So just some simple information to come in, and that's for all your family members if you're enrolling for an entire family.
Wow, great. Now, there's some questions that have come in. Will I receive a lower premium or financial assistance with my selected plan?
So last year, 85% of the people that enrolled received financial assistance in terms of the marketplace.
85%?
Yes. Okay. So there were also people who came in and went through and enrolled in Medicaid, which obviously is also financial assistance. So the vast majority of people are receiving assistance to make sure that this care is affordable. And what we know now is that this year, as we look at the people that enrolled last year, 8 out of 10 of those people that enrolled last year, if they come in, they could find, with that assistance, a premium that's below $100 a month.
Below $100 a month. That's amazing.
100 or below.
That's
yes.
amazing.
100
now,
or below.
You talked about Medicaid. Now, what if my state did not expand Medicaid?
So then there are options for you in terms of trying to get financial assistance in terms of, as you're in that bracket, in terms of above 100% of poverty, that you may be able to get the financial assistance. So you should come on and shop and find out what kind of assistance you can get.
So you should not stop because your state did not expand Medicaid. That's helpful to hear.
And we will continue to work to try and expand Medicaid further. That's a very important part of our effort as well, because the African American population, in terms of a number of those states, would be helped tremendously.
That's excellent information. Now, if I enrolled last year or earlier this year, am I required to enroll again?
You can be automatically enrolled, and that will start on December 15th. And that means you'll be re-enrolled in your plan, or if there's been a change, the plan that's most similar. But we want to encourage everyone to come in and update their information, shop, and enroll themselves. And that is because when you do that, there are 25% more issuers, so there are more choices. And we want to make sure that you maximize on the financial assistance that you'll get. As I said, premiums change, policies change. Coming in to update your information and look at that information will be the way that you can best ensure that you get the financial assistance that you are able to get, and do that in the most and make sure you maximize for that.
Great. So there are some more options. That's great to hear. Now we're going to take a little turn in our segment today. We have a young brother named Vaughn who is joining us, who is now insured thanks to the Affordable Care Act. Let's roll the video and hear his story.
I'm a publicist, which means that my job is to expand the brands of the clients that I have. When I found out I had the opportunity to go to a PR firm, I did have to look at the fact that they did not have health insurance, but it was okay. I signed up in the marketplace. It's definitely easy to sign up. If you can register for Facebook, Twitter, Instagram, Pinterest, then you can definitely sign up for the marketplace. I use my health insurance on the regular. So I use it to get my prescriptions filled. I do get a physical every year, and I also just get checked up, whether it's National HIV Testing Day. I'll go to the doctors and I'll get tested to make sure that all is well. And let's be honest, I am a young African American man, and if I'm going to be sexually active, I need to protect myself. And by protecting myself, that means getting checked out. Having health insurance means that I can live a long, healthy, prosperous life. I'm into living, and I want to be here. I've got a lot of work to do. I've got a lot of dreams and goals to accomplish. I am one of the millions that have signed up for the marketplace, and it feels great. I'm so grateful that I have health insurance because I can take care of myself the way I need to be taken care of.
Vaughn is here with us today. Vaughn, welcome all the way from Atlanta, Georgia. Thank you for joining us.
Thank you for having
Awesome,
me. I'm so excited to
awesome.
be on with
So,
you.
Vaughn, I have a couple questions for you and wanted to make sure you had a chance to talk to our listeners as well. Now, what has having coverage meant to you personally?
Having coverage has just meant the world. It means that I am protected. It means that I'm safe, I'm secure, and it means that I can definitely take care of myself.
Absolutely. Now, Vaughn, tell the listeners, do you plan to re-enroll again?
I am going to re-enroll, and I'm going to do that by Friday. I promise.
Good, Vaughn. I'm glad to hear that you're going to get that done. It
I
was
just learned a lot from you just now when you talked about how the plans could actually change, or there might be a better option. So I definitely need to re-enroll.
and make sure you update your information, go in and make sure you hit the enroll button at the end, and so you'll know it's 90% pre-populated, so you're not going to have to enter all that information again and again and again. All your information from last year you can read through, check it quickly and easily, and get to your shopping fast.
Oh, that's awesome. Thank you so much.
Vaughn, thank you so much for joining us all the way from Atlanta, Georgia. Your story is an inspiration to all of us. Again, we had Vaughn all the way from Atlanta, Georgia. Madam Secretary, I'm going to turn it back over to you because I have another question. Can you talk about some of the other plan benefits that are available in the marketplace?
So there is something for any plan that's in the marketplace. It must have something called essential health benefits. And that's a list of 10 things. And things that are on that list are things like, if you pregnancy, there are things like emergency room, prescription drugs, mental health and substance abuse services. It's a list of services that any plan that's going to be on the marketplace is required to have so that we have consistency in terms of what kind of care people are going to get. So that's in terms of the marketplace. But for everyone else who already had employer-based care or other care, there were some changes in the law that are important too. And that means that no one can discriminate based on pre-existing conditions. So if you ever need to switch a job, you don't need to worry. It means there aren't lifetime or annual limits. And it also means that for preventative care, many types of preventative care don't have a copay. When you take the kid in for their wellness, their annual wellness checkup, there's no copay. And that's for people who are employer-based care as well. So in the marketplace, there's 10 essential health benefits, but there were also benefits in the Affordable Care Act that went to the broader community, those already insured and had employer-placed care.
You know, it's so helpful to hear about the essential benefits because I think many do not understand what's available in these plans. So that list of 10 essential benefits is going to be more than helpful for our listeners here. Now, I have another question. This is on behalf of the NAACP. We have over 1,000 chapters across this country. And one question we had for you is, what can NAACP units, those are our chapters, what can they do to assist in the enrollment period and enrollment activities?
So I've been lucky to actually see some of those folks in my visits all around the country since open enrollment, and they are doing right now. And what they're doing, there are a couple things. So making sure everybody you know knows about open enrollment and making sure that the chapters know and know to communicate about that. Many of the chapters are actually involved in enrollment events, and enrollment events are events where there are navigators, people who can help walk people through, or assisters that can help walk people through, but a lot of it is about creating awareness through a trusted source. And that's what those local chapters are, a trusted source, because this is something new for some people. And so having those chapters be informed, to inform members of the community, because that's how the ball starts rolling. When someone you trust tells you, this is something you should look at, this is something you should do for your own financial security and for your own health security, and that it will be affordable, and helping connect people, and there are different ways to do it. 1-800-318-2596. That's if you want to call and speak to a person, if someone wants to do that. Another way, for somebody who wants to see somebody in person, some people first time need that in-person assistance. Go to localhelp.healthcare.gov, enter in your zip code, and you can find out where to find a live person to talk to. Then the third way, and this is what many people do, and we've tried to make it easier and faster. As a matter of fact, for about 70% of the people, we've gone from 76 screens down to 16. So faster, faster for folks. And you can use healthcare.gov or cuidadodesalud.gov if you want to try it in Spanish.
All right. That is very helpful. We have a bilingual secretary here also.
I think we've hit my limits, but...
Awesome. So you're here with the NAACP Connect Google Hangout with our special guest here live at the United States Department of Health and Human Services Secretary Burwell. Now, I wanted to just close out. The NAACP, we are excited to be here with you, but also to tell you that there are a number of cities that we're targeting for some of our enrollment activities as well. In the coming new year, we'll be in Atlanta, we'll be in Baltimore and Phoenix, we'll be in Northern New Jersey, which is my hometown, the state of New Jersey, and Las Vegas, Miami, and Dallas. So we just wanted to share that with the viewers here, that there are some enrollment activities coming to a city near you, and you can actually reach out to us on NAACP.org. I'm going to turn it back over to our special guest here to just say, Madam Secretary, to close us out, what are some of your final thoughts? What do you want the listeners to walk away with today? And how can we make a difference with the Affordable Care Act?
So I think what I want listeners to walk away with is, if you're insured in the marketplace, come back before December 15th, just like Vaughn said he was going to. Come on back in. Make sure your information is up to date. Do that shopping and enroll, so you make sure you get the best financial assistance that you can and the best plan for you. And so do that before the 15th. You'll be automatically re-enrolled, and you can do it afterwards, but best to go ahead and just get it done. Mm-hmm. And then for those who aren't insured, come in. You can find affordable coverage in the marketplace, and come in and shop and see that you can find a plan for you. Those are the two things. What should people be doing? Making sure people know. The open enrollment period, November 15th to February 15th. That's the timetable, making sure people know and that they have access, and that they know the kind of benefits and help that they can receive to improve their financial security, and most importantly, that health security for people and their entire family.
Awesome. And what I heard from our secretary is that you should not be afraid. You should come back. You should go on to healthcare.gov. You've heard the numbers. Can we get the numbers and the website just one more time?
Absolutely.
So listeners can know?
I'm more than happy. 1-800-318-2596, healthcare.gov, and localhelp.healthcare.gov if you want to find that in-person assistance. And I also encourage people, we do second Sundays, which is very important in terms of the faith community.
Yes, it is.
And we'll be doing that. I'll actually be going to a church this Sunday.
Awesome.
In Texas, a large African-American church in Texas. I'll be headed there this Sunday, and we do second Sunday, so those will be some special events in addition to the great events that the NAACP is doing across the country in all those cities.
Awesome. So you heard it right here. Second Sundays, this is a huge part of the African American community, our faith community, so we know this will be an engagement, and most NAACP units across the country have a connection to one of those local churches, so we know you'll see some NAACPers when you head down to Texas.
I usually see those folks together, so it's good.
Awesome. Well, Madam Secretary, we want to thank you so much for joining us today and taking the time to talk with the NAACP listeners here on NAACP Connect Google Hangout. And if you want additional information from the NAACP, you can text the word health to 62227. That stands for NAACP. That's 62227. You can text the word health. And again, before we close, the phone number and the website, Secretary Burwell?
1-800-318-2596, healthcare.gov. Or if you want that in-person assistance, localhelp.healthcare.gov. We hope we'll see you there.
I think you'll see a lot of people there. We are doing an amazing thing with this Affordable Care Act, and you have been a great leader. And we thank you on behalf of the NAACP Connect family. And we want to just give you a big handshake to tell you we're going to help you in this process.
Thank you so much, and thanks for having me.
Thank you, listeners. You all have a wonderful day.